Our next speaker is Dr. Cort Lohff, and related to the previous title of why we care about lead poisoning, I just want to address that I think we all care, all of our speakers care about lead poisoning, and that's why we're here today. Dr. Lohff is the medical director of the Division of Environmental Health in the Chicago Department of Public Health. He previously served as a state epidemiologist and chief of the infectious disease at the Vermont Department of Public Health. Dr. Lohff has worked as a practitioner, a researcher, an academic, an administrator in Iowa, New York, and Vermont on public health issues. He's a dedicated advocate related to lead and other environmental toxins issues. He's published widely on infections and non-infectious diseases and outbreak investigations. This is a very brief bio. We have much longer bios of all of the accomplishments of our speakers today, but in the interest of time, I'll conclude there and welcome Dr. Lohff to the podium. Thank you.
Okay, everybody hear me okay? I might have to squat down a little bit here there we go. So thank you, Catherine, for the nice introduction, and for Anita and you as well for organizing this great session, and for all of you here today to come and listen to this. Let's see here. So in preparing this talk, both Catherine and Anita asked both the Cook County Health Department and the City of Chicago Health Department to address a number of issues. And of course, our time is kind of limited here today. So I think in the interest of in the interest of time, we're going to provide some things at a very high level. And certainly, hopefully towards the closing of this session today, we can maybe get into some more detail about some of these things as well. So my first series of slides are going to talk about the legal requirements and the recommendations for both screening and reporting. Screening, of course, is testing children for the evidence of elevated blood lead levels, and then reporting is what happens after that when a provider and laboratories are required to provide that information to state and local health departments. So first at the federal level, so federal law through the Center for Medicare and Medicaid Services requires that all Medicaid enrolled children 12 and 24 months of age be screened for lead poisoning. For those children who have not been screened at ages 12 and 24 months, then Medicaid requires that a child be screened between the ages of 36 and 72 months. And this screening requirement is a part of the EPSDT benefit which all Medicaid eligible children are entitled to. So very interesting, very lately I should say, CMS CMS came up with a new policy whereby states may actually apply to them to be granted the ability to do more targeted screening of Medicaid and eligible children if the states had sufficient evidence to actually support that change. Currently, that is not the case here in Illinois. So in Illinois, all Medicaid enrolled children are required by CMS to be screened at these various different age levels. And the nice thing about this is that there's also a provider bonus. So if providers of Medicaid enrolled children meet certain thresholds, then Medicaid will actually provide them with a bonus. So at the state level, we operate under the Illinois Lead Poisoning Prevention Act and the corresponding code. Basically, what the act and code says is that all children 6 months to 6 years of age should be tested or screened for lead poisoning if the child resides in a high-risk area. Older children and as well as pregnant persons may also be tested, and this includes older children as part of the school health exam if the provider feels that the child is at high risk of lead poisoning. Of course, the federal law for Medicaid enrolled children applies here in Illinois as it does elsewhere around the country. Additionally, all children must receive a screening blood test prior to admission to a child care facility. So this is just another way of ensuring that children are being screened for lead. And then lastly, as part of efforts to try to educate parents about lead, child care facilities that participate in the Illinois Child Care Assistance Program are required to annually send or deliver to parents or guardians of children enrolled in the facility's care an informational pamphlet regarding awareness of lead poisoning. And lastly, wrapping up here, what happens in Chicago. So, of course, in the city of Chicago, we're governed by the Chicago Municipal Code. That code basically says the same thing that the state Act says regarding testing, in that all children must receive a screening blood lead test prior to admission to a child care facility, including kindergarten, and subsequently during required physical exams. Again, this is the same as the state law. There's also a provision in our code that requires education and information to go out to parents of children enrolled in daycare centers, daycare homes, preschools, nursery schools, and kindergartens, or other child care facilities licensed or approved by the state. And then lastly, I just want to close up with what the recommendations are here in Chicago for screening. So these screening guidelines were put in place back in early 2000s. They're currently active, and they're actually quite extensive screening recommendations. The goal here is to try to capture children as soon as they're more at ages. The goal here is to do as much screening when a child is less than 3 years of age, to try to capture when that child might start to be exposed to lead. That way you can step in and intervene on behalf of that child to prevent further exposure to that child and to their siblings. So Chicago screening recommendations are age and risk-based. So children 6 to 36 months of age, there's a series of tests recommended starting at 6 months or 9 months. And then children 4 to 6 years of age, screening blood lead tests should be done annually unless that child has a prior history of at least 2 annual blood tests less than 10. But if there's any changes in the child environment, for example, they moved into a home built before 1978 that has peeling or chipping paint, or the home has recently undergone renovation or repair, or the child continued oral behavior, then the provider should test that child as well. And of course, there's additional guidelines for follow-up testing on children with abnormal levels. And I just want to point out, in terms of the risk status, of course, Chicago is considered high risk under the Illinois Lead Poisoning Prevention Act, which means there's universal screening here in the city of Chicago. So any child that is of these ages should be tested regardless of where they live in the city. Lastly, I just want to wrap up, talk a little bit about reporting again. So when a provider lab collects a lead sample from a child, they're obligated per state law to report that information to the public health authorities. All results are reportable regardless of the blood lead level. So even low levels are reportable. And this is important for us because it helps us really understand which children are getting tested. And it also helps us understand what the percent of children that are tested that have elevated blood lead levels. The timeliness of the report is based on the blood lead level. So basically, if the child has a very high blood level, the provider or the lab is required to report that to public health authorities much sooner than at the levels lower, for obvious reasons, because if a child has a really high level, we want to know about that right away so we can go out there, do an inspection of the home environment, and try to identify, then remove that hazard if possible. And then information is required in the report that helps us as public health authorities to locate the child. In practice, because most of the reporting is done electronically, almost all reports on children in Illinois, including Chicago, go directly to the IDPH, and then those children that are Chicago children, then that information comes to the city of Chicago electronically. Next, I want to talk about, provide a very brief overview of data here in Chicago. So this first slide shows the number of children ages 0 to 6 years of age who received a screening blood lead test by year for Chicago 2000 and 2015. So as you can see, the general trend is that there's a large number of children screened each year. Approximately maybe 100,000 unique children in Chicago had at least one blood test between the ages of 0 to 6 years of age. You also note that between 2013 to 2015, there's a downward trend in the number of children that are screened. This next slide is a little more important because it really focuses on children who are less than 3 years of age, meaning children who have not yet reached their third birthday. And it's important to look at this group of children because these are the children at most risk for exposure to lead. So if these children are most at risk for exposure to lead, we want to make sure that these kids are prioritized over the older kids for screening. The good news here is that about 80, and this is, let me step back here a little bit. This is a percent of children ever screened by 3 years of age by birth year. So for example, if a child was born in 2008, by the time they reach their third birthday, around 78% of that cohort had at least one screening blood lead test by the time they reach their third birthday. In 2012, that number dropped to about 69% of children who ever received one screening blood lead test. And then lastly, I want to talk about the geographic distribution of screening blood lead tests in Chicago. This is a map by community area showing the percent of children aged 1 and 2 years of age who were screened by community area in 2013. So the darker community areas show that 61 to 74% of children 1 and 2 years of age living in those community areas had at least one screening blood lead test in 2013, whereas those community areas in the lightest shade only 20 to 40% of those children 1 and 2 years of age had at least one screening test. And this is an important slide because I think it shows the fact that our community areas that we really want to target for screening as well as for intervention are certain community areas on the south and west side. And this map shows that a large number of those community areas on the south and west side that we know have a higher prevalence, historical prevalence of elevated blood lead levels are those community areas that more likely than others have a higher screening percent. Next, I want to turn my attention to talking about the results of those screening efforts, meaning what are the blood lead levels of kids that have been screened. This first slide shows the percent and number of children 0 to 6 years of age who are screened that had a blood lead level of greater than or equal to 10. And these data are from 1997 to 2015. And as was indicated by Dr. Bin's presentation, we've seen dramatic declines in the numbers of children as well as the percent of children tested that had elevated blood lead levels. So if you look back in 1997, about 25% of children screened in Chicago had levels of 10 or greater. Now in 2015, that number is 0.7%. This next slide is very similar to the first, but we're focusing here on blood lead levels of 5 or greater. Obviously, the lower levels you go, the higher numbers of kids are going to have an elevated blood lead level. So back in 1997, around 70% of children screened in Chicago had blood lead levels of 5 or greater. That number has dropped to 3% in 2015. So again, we've seen dramatic declines in the numbers of children and percent of children tested that have had elevated blood lead levels. So obviously, that is very good news. But I think that the problem remains is that we have significant disparities here in the city of Chicago. And that those disparities are reflected here on this map, which shows the percent of children under 3 years of age with blood lead levels greater than 6 by community area for the year 2014. And again, you see certain community areas on the far west and south side that have disproportionately elevated levels of blood lead levels. So I think, again, despite the dramatic successes in lowering children's blood lead level over the last decade or so, Chicago, like many other areas, still has significant problems, especially in certain geographic areas of the city. In my few next remarks, I just want to go through a few other data points. I want to show a little bit about housing data. Again, as we all know, Chicago has a large percent of very old housing stock. In fact, around 50% of the housing stock was built before 1940. And again, if that housing stock is more likely to have lead-based paint, and if it's not maintained properly, then that can create lead-based paint hazards. The other thing I want to show here is that when we go out to do inspections, we obviously look for lead-based paint hazards, and about 80% of the time we do those inspections, we do find lead-based paint hazards in homes of children who are poisoned by lead, and that 80% number is relatively consistent over the last 3 years. So again, this just shows the poor quality housing in children who have elevated blood lead levels here in the city of Chicago. I want to talk very briefly about a study that we conducted with the Chicago Department of Water Management that helps us to begin to understand what the impact of drinking water is on children who have lead poisoning in the city. In 2011 and 2012, the Chicago Department of Public Health partnered with the Department of Water Management on this study. In addition to doing our usual inspections for lead-based paint hazards, our inspectors collected water from 173 homes of children who had elevated blood lead levels. We collected the first and the sixth liter to try to catch potential spikes from water that have been in direct contact with the lead service line, if that lead service line was present in those homes. Of the 173 homes, only 12 had levels of lead greater than or equal to 15. All these 15 were retested, and only 2 continued to have levels of 15 or greater. One of these homes was in mid-renovation, had fixtures that contained lead, and lead-based paint hazards were identified. The second unit was unoccupied that had stagnant water, so the lead dropped quickly after the first draw. The other 10 were likely contaminated by our inspectors during the sampling process. So again, although this is a very small study, it does show that there's, at least with this study, that there was not a correlation between children's blood lead levels and presence of lead in drinking water. So I quickly want to talk about a few other issues here before I close up. 1 minute, great. The health department is really trying to look at other ways of trying to address childhood lead poisoning other than just being reactive and going out to inspect homes of kids with lead poisoning. One of the interesting ways of doing this is that we're partnering with the University of Chicago Center for Data Science and Public Policy to do what's called the predictive analytics. And this is a project where we do predictive modeling to try to help identify and predict children at risk of lead poisoning by identifying the addresses at greatest risk of having lead-based paint hazards and young children living there. And this week, we're going to actually be working to try to actually validate that model. There's a number of other collaborations and projects that we're currently involved in on. We're continue to work closely with the Chicago Housing Authority and the Housing Choice Voucher Program to really help understand the impact of lead poisoning on children who live in Housing Choice Voucher Program housing. We're continuing our partnership with the Chicago Department of Water Management by shortly unveiling a new project where anytime we go in to inspect a home of a child with a lead-based with elevated blood lead level, we're going to be drawing water samples and having those water samples tested for lead. We're in partnership with the Chicago Public Schools to make sure that there are no lead-based paint hazards in these schools. We're partnering with a nonprofit organization called Ideas 42, which is currently based out of the mayor's office, to also do more preventive-based inspections and try to look at some models for behavioral intervention as well. And we recently unveiled a hardware store project where we are providing information to hardware stores to try to educate their customers about lead-based paint hazards and the renovation, repair, and painting rule. So I think that's my time, right? Great, thank you.